Hi, my name is JC Ivy. I am in Region 8, and today we're going to talk about dysphagia in ALS. What is ALS? ALS is amyotrophic lateral sclerosis, and this is defined as a neurodegenerative condition that affects how nerve cells communicate with our muscles. It targets the neurons within the brain and within the spinal cord, and we see that over time, ALS will continue to decline. We also see with ALS that it affects most of, if not all, of the body's systems. With ALS, the warning signs we are looking for can consist of muscle weakness, speech challenges, fatigue, muscle cramps, twitching, stiff muscles, swallowing difficulties, drooling, and involuntary emotional expressions. What causes ALS? We do not know fully what causes ALS, but researchers seem to believe that ALS can come from a combination of environmental factors as well as genetics. We see that there are more than 40 genes that are linked to ALS, but we also see that exposures to toxins such as mercury or lead can be causes of ALS, as well as different traumas or viruses that can be obtained over time. So swallowing and ALS. We see that based on research that 85% of patients that have ALS will also experience dysphagia. Some of the common swallowing difficulties that these patients can experience are heavy tongue, which is a sensation that the patient will feel due to the muscle weakness. With this heavy tongue, we see that it makes it very difficult for our patients to manipulate the solids and liquids within their mouth, which affects the mastication. It affects the oral phase and even the preparatory for the pharyngeal phase of the swallow. We also see that some patients will feel that they have this sensation or feel as if they're getting food stuck in their throat after the swallow has completed. Usually this will look like the patient is coughing frequently as they eat, after they eat, or you'll even see the bolus or liquids or solids that coming through the nose. Another sign that is consistent with ALS patients that also experience dysphagia is the consistent regurgitation of the solids or liquids during or after eating. How can we help? So as SLPs, the way that we can help these patients is we can start by initiating a swallow evaluation process. And this looks different depending on the patient and the facility you're in, but this could include a bedside exam, a modified barium swallow study, or a fiber optic endoscopic evaluation of swallowing. This will give the necessary information to then form a plan. Some safe swallow strategies that we can also implement for our patients would be effortful swallow, double swallow, chin tuck posture, small bites and sips, and other pacing strategies. We can also address dietary modifications that will ensure proper hydration and nutrition if the patient is unable to get the nutrition they need from oral feeding. We also see a huge part of our scope with ALS is the need for communication. As ALS develops, we see that it affects the communication by weakening the muscles that are necessary to speak. Signs that we see that the patient can present with is a strained voice, slurred speech, or nasal sounding speech. Some helpful communication strategies for patients with ALS can consist of projecting the voice, pointing, resting your voice when not at use, getting the listener's attention before speaking, speak face-to-face, breathing exercises, speaking in a well-lit and quiet environment, and the use of AAC. We can also see that the use of AAC is a very useful and adaptive way for our patients to still have communication with the people around them. We see that there are high-tech and low-tech options, and these can, with the amount of options, we can see that they're almost something to fit every patient's needs and functional levels. Some of the low-tech options that we have and can find would be your traditional core boards or printed visuals, and high-tech options being tablets, computers, and other technology that can be used with touchscreen, a head mouse, or even eye gaze. These are my citations and sources that I got my information from, and thank you so much.